The communication access symbol is the newest access symbol in Australia. In 2009, the Communication and Inclusion Resource Centre led the development of a symbol to represent communication access. Over 1,700 people participated to select the symbol. The process meets Australian standards. To display the symbol, places and services must meet specific criteria for communication access. When people see this symbol, they will know that the place or service is communication accessible. I hear by touch and speak by sign. Heather is a deafblind woman, and touch is most important in her life. Touch is her ear and eye to the world and to communicating with people. Heather is a founding member of Deafblind Victorians, and she is also a committee member. Heather was born deaf and used Auslan as her first language. However, she started to lose her sight in her mid-20s. At first, she remembers she used to write on paper with a thin, regular pen. Then she had to use a dark black pen to write and read people's notes. After some time, she wasn't able to read the pen anymore, and she started to practice recognising the feel of people tracing the letters on the palm of her hand. Mostly, Heather has a support worker or interpreter when she goes into the community. But when she goes to a shop independently, she shows the shop assistants her special communication book with Braille Dymo labels to instruct them how to communicate with her and tell them what she wants. They indicate the cost on the palm of her hand. Heather communicates in these ways everywhere. It may be on public transport or in the bank. She uses the same method with the bank tellers. She asks how much she has in her bank account balance, and they indicate on the palm of her hand. When Heather goes to the train station, she can't see the times of the train's arrivals. She feels that staff at Flinders Street Station have learnt her way of communicating. It's because they're willing to communicate with her in her way. It's very important to her that people do it right. They must write on her hand slowly, using big letters and using short sentences, in the same spot, letter by letter. It makes her life more relaxed when people communicate with her in the right way. And this is why she says, I hear by touch and speak by sign. People made places communication accessible by getting to know the person and how they communicate, using clear communication, take time so the person can get their message across, treat the person with dignity and respect, treat the person as a valued customer, and use the person's communication method. Our vision is to create communities that are universally accessible. This means communities are accessible for all people, including people with communication difficulties, physical disabilities, such as people who use wheelchairs, reading difficulties, vision impairment, and people who are deaf or hard of hearing. Communication access. Imagine if you had to communicate and get your message across without using any speech. Did you know that 1 in 500 people in Victoria need communication aids and strategies for successful communication. People with communication difficulties may communicate using electronic speech devices, word-based or picture-based communication boards or books, signs and gestures, and spelling. People with communication difficulties experience many communication barriers to fully participating in community life. They want people in the community to be welcoming and friendly, look and talk directly to them, give them time to get their message across, listen to what they have to say, and be willing to use their methods of communicating. Scope's Communication and Inclusion Resource Centre is promoting the concept of communication access in collaboration with people with communication disabilities, the Communication Access Network in Victoria, peak bodies and key organisations. Together, we want to create communication accessible communities. Tips for communicating with a person who is deafblind. Don't make assumptions about the person's degree of deafblindness and their disability. Approach the person from in front rather than from behind. If the person has some vision, they may see you coming. Gain the person's attention before you begin to speak. From a distance of approximately 6 feet apart and waving your hand at chest level, a person with residual vision is likely to see you. Let the person know who you are and what you're doing. Communicating on introduction. The way you communicate will depend on the person's preferred communication and their vision and hearing impairments. Identify yourself by name. Identify any additional people in the room. Always use clear speech with normal pace and tone, and don't shout, as this may be distorted. Ensure there is nothing covering your mouth when you speak. If the person cannot hear speech, you can approach by gently touching the back of the person's hand. Be patient and give the person time to initiate a response. If an interpreter is present, you should face the person who is deafblind and direct your communication to the individual rather than the interpreter. And if you are unsure of anything, please ask the person. Being a creative florist does not depend on how well you hear. Marjorie is deaf and she is a florist from Ballarat. She's been working at Stem's Flower Market and the Flower Connection for several years now, and she thoroughly enjoys her position. Her colleagues are highly supportive. She loves preparing bouquets and arrangements and helping customers. When Marjorie speaks with customers, she explains that she is deaf and that by talking slowly, we'll be able to communicate. She always carries pen and paper in her apron in case a difficulty arises with communication, or she shows or points the flowers in the shop. The owners of the Flower Connection provide an inclusive workplace where Marjorie is part of the team and feels her contribution is valued and respected. The managers achieve this through supporting staff to understand the best ways to communicate with Marjorie. If they notice that Marjorie is not responding to a customer when they speak to her, they will easily just tell the customers that Marjorie is deaf and they should stand where she can see them. Marjorie is skilled at communicating in many different ways. She lip reads extremely well and uses Auslan. Marjorie was raised in Ballarat, when there was a strong focus on teaching deaf children to use speech. However, these days she uses Auslan. People made this place communication accessible by treating the person with dignity and respect, understanding there are different ways to communicate, speaking directly to the person, making sure there's no glare behind the person talking to Marjorie, knowing and using the person's communication method, making an effort when you can't understand the person, and sharing information about how Marjorie communicates. If a person with a communication difficulty comes to your service, do you speak to them directly and not to their friend or family member? Give them time to communicate? And try other ways to communicate, for example, pointing to objects or pictures or providing paper and a pen. If you answered yes to all of these, you are already on the road to becoming communication accessible. Now, you can be publicly recognised as a communication accessible business or service. You can register for a communication access assessment. We will provide support and information on how to be awarded the communication access symbol. All communication accessible services and businesses are listed on the Directory of Communication Accessible Venues on Scope's website. To display the communication access symbol, you will need to be assessed and meet the minimum standards for communication access. Communication access criteria includes people. Treat the person with dignity and respect. Take time, do not rush the conversation, and talk directly to the person. Communication skills. Staff in businesses and services are willing to use different methods of communication. For example, pointing to objects and pictures, using gestures, and asking yes or no questions. Communication environment. Service desks and items are positioned so customers who use wheelchairs are able to move around easily and point to items. Quiet spaces are available where you can have a conversation. There is a well-lit place to have a conversation. Signage. Signs are easy to see, for example, at eye level. Signs are easy to read and also have pictures or symbol on them. Written information. Staff read and explain written material to people who ask for assistance, for example, menus, documents, and health information. And information is available in different formats, for example, plain language or easy English, braille, large font, or audio versions. We asked 3 people with communication difficulties if you saw 3 taxis and one of them displayed the communication access symbol, would you select that taxi? Yes, we would. Here are some tips on successful communication. Be welcoming and friendly. Treat the person with dignity and respect. Know there are different ways to communicate. Ask the person what will help with communication. Find a quiet place. Listen carefully. Don't pretend to understand. When you can't understand the person, let them know you're having difficulty and ask them to repeat. If you are having difficulty understanding, try asking questions so the person can answer yes or no. Check back that you have understood correctly. Speak directly to the person and make eye contact. There are some people who may not want you to look at them, for example, some people with autism spectrum disorder. Be patient and give the person time to respond. If you ask a question, wait for the person to reply. If you think the person has not understood, repeat what you have said or say it in a different way. And speak normally. You don't have to raise your voice or slow your speech. My speech is difficult to understand, but I have something to tell you. Last year, Ron took his mum out to lunch on her birthday. The whole family went. It was at a local club, and he could not fault their service. Ron could swear the waitress had training in disability awareness. The waitress took the family's orders first, and this is the way Ron wanted it because then he didn't feel pressured. This gave Ron more time to work out what he wanted and then to type the message into his communication aid. Even when he was typing long words like cappuccino, which are a bit harder, she was patient and gave him some time. She asked the appropriate questions and she didn't interrupt. It was a very pleasant experience and a lovely time out with the family. These tips are for communicating with people with autism spectrum disorders. Use simple language. Be patient, give the person time to answer. Communicate one idea at a time. State your message clearly. Speak in a normal tone of voice. Give specific choices rather than open-ended questions. Some people with autism spectrum disorders may find it difficult to look at you and listen at the same time. Say what you mean using literal language. And avoid using ambiguous language like sarcasm, metaphors or jokes that could be misunderstood. Communication access is important in 4 ways. People who have communication difficulties can access their community, be included and participate in community life. Inclusive communities are healthy communities. Accessible businesses attract more customers. And communication access upholds Australia's commitment to the United Nations Declaration on the Rights of Persons with a Disability. Communication access is when everyone can get their message across. Communication is a basic human right. Governments around the world have developed laws and policies to ensure that everyone is included in their communities. There are 5 legal documents in Australia that support communication access as a human right. The United Nations Convention on the Rights of Persons with a Disability. This recognises that communication methods other than speech are part of everyday communication and calls for removing all discrimination and recognises the rights of people to use support workers and technologies for access to the wider community. The Federal Disability Discrimination Act. This act is made up of laws to prevent discrimination against people with disabilities. The Victorian State Disability Plan. The vision of the Victorian State Disability Plan is to create accessible environments and inclusive communities. The Victorian Charter of Human Rights and Responsibilities Act. The Charter is Victorian law that sets out basic rights of all people in Victoria when providing services such as healthcare, education and law enforcement, to ensure that all public authorities consider human rights when they make new policies and laws. The National Disability Strategy. The first national approach to supporting people with disabilities, which aims to create communities across Australia that are inclusive and provide equal opportunity for all people. It recognises that people with a disability face many barriers which need to be broken down. Australian and Victoria law requires businesses and services to provide equitable access. They are required to comply or risk breaching equal opportunity law. If you want to know more, contact Scope's Communication and Inclusion Resource Centre. For information on communication access assessments, communication aids and resources, communication accessible venues, alternative communication, or accessible written information, please contact us.